I understand you also do hearing tests. Tell us about them.
We have the otogram that we perform in my office, and it's a state-of-the-art hearing test. It's a full audiogram, so you get the pure tone and what we call the air and bone conduction hearing test. You also have a test that tells you something called discrimination. When people lose their hearing, they don't just lose a volumetric loss, where if you turn it up louder, it's better, which is what a hearing aid does for you. Some people also lose what's called discrimination, so that even if you make things loud, they don't quite get it. Things are muffled, and we can determine that. And sometimes in a standard hearing test, people don't get that checked. So when people have background noise, or people are speaking and not directly looking at someone's face, sometimes people still have trouble hearing what it is, even if they have hearing aids in place. So that discrimination testing is very important. In addition, we can measure the pressures behind the eardrum. That's called a tympanogram. The otogram itself is interactive. It's almost like playing a video game. So it's a touch screen component when you're doing the discrimination test, and older children like it because they think it's kind of fun.
Doctor, who should have their hearing tested?
If you feel like your hearing is decreased, if you're watching TV and your family's complaining that everything's getting pretty loud and they can't watch with you, or if you feel like you're going through the day and you can't quite understand what people are telling you. Sometimes you can tell when people are having hearing loss because they respond inappropriately to whatever is being asked. And so there's no need for them to struggle. There are hearing aids and other assisted devices that we can use to help amplify things for patients who can't hear. It's not something that they should be ashamed about. It's something that just should be checked like everything else.